my name is Doreen Skolnick. I am the clinical social worker on the neurobehavioral unit. Today we're going to talk about some of the emotional stages of recovery. And this is geared for really the caregivers, and this is a guide for the caregivers to better appreciate what happens following a stroke. Well, the very first stage after a stroke is a period that is very difficult for the patient, and what we use is the term confusion and agitation. And if you think about it, they're waking up in a hospital bed, their body is not working, there are lights going on all night, they have not been sleeping, and with the confusion comes a lot of agitation, all right? But again, put yourself where the patient is. They might have collapsed, they don't know what happened, and here they are in a hospital bed. And with the confusion, again, what happens with the confusion? They're agitated. That's very, very difficult for the families to see, but again, that's very common to see after a first early stage of a stroke. All right, so now they're in the hospital. They know something's not quite right. All right, they're mad, they're agitated. But even though they know something's not right, what we see as time is moving forward, the classic thing is denial. Now let me explain what that means. There's that emotional piece is, I'm okay. Why am I here? I can go home. All right, now that puts you as a caregiver in a very difficult position because you know they're not ready to go home. And what you also have to understand, part of their saying this is there are changes to their brain. All right, and they don't understand, and I always use the expression, they don't know what they don't know. So let's think back. They came in, they were angry, okay, they were confused, okay, they were agitated, then came that period of denial. Now they've been in, they're getting their rehab. What happens? All right, what we see often is anger and depression. Now, there's a flip side to the anger and depression. Let me explain. When a patient starts exhibiting more signs of anger and depression, actually they're getting better. Let me explain that. Because in the very beginning, in those early stages, remember what I said before, they don't know what they don't know. They're flat in terms of their affect. They're not emoting. But when they start showing those signs, and I'm not saying those signs are easy to take when they're angry and depressed, but it actually means they're getting a better sense of what's going on around them, all right? And as they get a better sense, they're angry, and the flip side of anger is depression. So as they get better, all right, and we're thrilled that they're getting better, there's also that testing phase, because remember, they don't really want, there's still that bit of denial, and they don't quite know what they don't know, and they want to see. And it's just like with a child who you tell them not to touch a stove, you can be sure that they're going to touch that stove. Well, patients do that too. If you're in the hospital, you will hear all sorts of alarms and bells and whistles going off because they think they can get out of bed by themselves, and they're false. All right, that's what we refer to as the testing phase. They are trying to do certain things on their own because they think they can, and they really can't. That's at testing as they now are getting better. Remember, anger and depression, they're getting better, but they're still trying to figure out what exactly they can do, and that is classic. Now, as they get better, there's a period, all right, what we're trying to do is show the classic stages of what I call the uneasy acceptance. Part of this is to sort of get to the point of, this is now my life. I use the expression, there's a new normal. New normal is not bad, it's different. It's incorporating some of the old with some of the new, and this is where they are. Now, when I say uneasy acceptance is not just for them, it's for you as a caregiver. Because if you keep holding on to, will they ever be able to do the same things they did before? I will say maybe, we don't know. But your loved one will have an easier time of accepting where they are now if you accept the new normal. And again, new normal is not bad, it's different. And that's part of all of you moving forward. Now, what influences and what impacts how they do? Well, whenever I meet a patient and family in the very beginning, I need to know who they were before this, because all of those things will impact their recovery. all right? So some patients who've had issues with depression or anxiety will have a harder time for a period of time post-stroke, all right? Some things to do for patient and family to do better are sense of humor, a good work ethic, making them feel like they can help others. All of those things are really, really important, okay? Some patients obviously will have more difficulty. Some of that difficulty is they can't get out of themselves. Everything is negative. They are miserable all the time. Again, some of that can go back to who they were beforehand. Now, if they had issues, again, when I talk about factors, if they had issues with anxiety, depression beforehand for a period of time, it will only get worse. It does get better, but you have to understand who they were beforehand impacts how they are and how they recover. Thank you so much for watching. This is such an important series.